I'm Julie Bartke with this Senate update. Roughly 30 to 70% of Minnesota's incarcerated population has a diagnosed mental illness. Senator Barb Goodwin has a plan that she hopes will ease the burden of law enforcement housing this population while providing treatment to those with a mental illness. She presented her bill to the media on Tuesday.
Basically, this bill will create some centers, and I'll let my two authors in the House that have really done a great job on this too, and heard a lot about what's going on, talk about more about the bill itself. But what we're trying to do is create a single point of entry for people with a mental illness, where police have the option to bring them and drop them off, and they will have crisis beds, they will have outpatient services, they will have access to a number of mental health resources. They'll have access to getting on health insurance or Medicaid or Social Security, disability, whatever. They'll have that access so that they can get medicated, they can get back on the road. One of the things that happens now is that people are recycled over and over again, and it's costing the state a lot of money through the courts, through the jails, through the emergency rooms, and the service is just so disjointed that people that have a mental illness, if they're told, okay, now you're done with this, go over there and get your other services, or go over there to look for housing or whatever, it's not going to happen. So what we're trying to do is develop these integrated centers where they can get all the services they need in one place, or at least get access to services around them. And we want the private sector, the public sector, the counties and the state to all work together on this, to be integrated and themselves, and cross budgets and work on this together. So we're giving up to $2 million per grant to start one of these centers, to get it rolling. In order to get a grant, they have to say how they're going to work and collaborate and what they're going to include in their center, and they also have to say how they're going to fund themselves after the $2 million is gone. Are they going to be able to, and they can probably access federal grants, they can probably access other state funds, they can also coordinate with other counties and share expenses, and they can coordinate with privates and nonprofits and share expenses as well. So that's kind of the overview, and next I'll ask Representative Hancock to talk about his particular issue, which is Senate File 142, and I forgot his House file number, but it's on the Bemidji area particularly.
Thank you, Senator Goodwin. Dave Hancock, representing Beltrami County. It's House File 339. Just a little background, I came to Beltrami County in 1973. Since 1980, which is when the census was, Beltrami County had approximately 30,000 people. Today, 2015, that's approximately 45,000 people, or a 50% increase. In 1980, the Beltrami County Jail had an average population of 21.4. Today, that average is about 130. That's a 600% increase. Sheriff Hodep tells me that over 70% of the people in Beltrami County Jail have been diagnosed with some form of mental illness. We may be the epitome of the crisis here, but I think we also have the stakeholders in place that can develop, as House File 339 would say. It charges Beltrami County to fund and convene the project stakeholders to develop a sustainable, integrated care model for the provision of mental health and chemical dependency services for adults and children under arrest or subject to arrest. These would obviously include patient-centered, culturally competent, must be based on evidence-based practices, and should have the capacity to be replicated elsewhere in the state. I think at a meeting that Senator Goodwin called in Bemidji a number of months ago, there were 40 or 50 stakeholders involved, including police departments, public safety from Red Lake and from Beltrami County. We had local police, we had judges, we had mental health care providers, we had people from all sorts from Sanford Health Unit, all eager to address this situation that Senator Goodwin has laid out. You know, right now in a crisis bed, we sometimes have to transport them 150 miles because we don't have the facilities in Bemidji. So I'm excited about developing this project and the model. And hopefully we can replicate that throughout the state and develop these centers. Thank you.
Good afternoon. I'm Nick Zerwas. I'm state representative for 30A. I represent Elk River, Big Lake, and a little bit of Otsego, Sherburne County, and Wright County. I want to thank Senator Goodwin for bringing this bill forward and asking me to help carry it in the House. In establishing these crisis intervention mental health centers around the state, what this will allow is an opportunity to take the pressure off of our local jails within our communities. Just last week, in speaking with Sheriff Brott from Sherburne County about what I was working on down in St. Paul, one of the things that he mentioned was just that day they had picked up someone for a very minor infraction who was causing a civil disturbance within the county. They brought him in. It turns out the person has a history of previously being committed, civilly committed within the state of Minnesota, and he was in a holding cell where they were having trouble getting him to stop bashing his head against the wall. And they literally had no place within 150 miles to bring that individual for the care and the treatment that he needs. And so clearly what we've seen over the last several decades, as we've had a push to deinstitutionalize mental health care across the United States and within Minnesota, we've seen a deconstruction of the framework to take care of these very critically ill individuals. And when you get to an acute incident where law enforcement is called, law enforcement, generally speaking, isn't the best tool to handle that type of mental health intervention. They have very few options. What this bill would allow law enforcement to do is make the identification pretty quickly that you had someone going through an acute mental health incident and identify that jail in a punitive process isn't the right approach for that individual, and that they need mental and medical and psychological help. And to get that individual into one of these facilities where they can be assessed, treated, and then given a framework or a plan moving forward. What's unique about this concept is it puts not only the acute mental health care in one place, but it also has the collaborative social services aspect within that same building, so that we're not just dealing with the one-time incident and then turning the person back onto the street, but we're able to get that person into the fold and provide them the ongoing support services that they require so that they can succeed outside of a long-term facility. It's an $8 million request to set up 4 sites across the state of Minnesota. This isn't the silver bullet for dealing with our mental health crisis across Minnesota, but this is one important step to move the ball forward, to take our mental health patients and our people having these acute crises out of the criminal justice system and get them where they belong, into a medical setting. Thank you for coming today.
I just want to say the status of the bill at this point, and then I'd like a couple of our law enforcement people to speak. We've had a tremendous amount of support from, in fact, a lot of this bill was put together because of the suggestions of law enforcement. We've had a lot of support. We have support from the Minnesota Board of Public Defense. We have support from the Sheriff's Association, the Police Chiefs Association, the Minnesota Police and Peace Federation, the JRLC Joint Religious Legislative Coalition, a housing entity, and Oh, gosh, we got a whole list. And Align Health Systems and some of the others. So it's really strongly supported. We do have a few opponents in the mental health field, but I think hopefully I've addressed some of their main issues in an amendment that'll be offered tomorrow. The bill will be heard tomorrow at noon in Health and Human Service Policy Committee in the Senate. And in Judiciary Committee that was heard a couple weeks ago, it had unanimous support. So this is a nonpartisan issue, which is great. We're all working together to try to solve a problem we know we have. So I guess I would like to, Judge Quam to come up. He is one of the first people that really talked to me about the immense need for this type of thing.
And you may wonder, why is the judge doing here? What we're talking about is pre-jail and pre-trial diversion. I've been on the bench for about 8 years, and I see what happens when people get involved in the criminal justice system. And it is like the previous speaker said, nothing really good happens once somebody gets into the system. And what judges see over and over is people coming into the system who are mentally ill, getting worse, not getting better, and coming back through and through. I'll have enough business, I promise, that if we solve this problem of people coming into the mental health business, we'll be able to have plenty of work to do that doesn't involve people with mental illness that shouldn't be in the criminal justice system. From my perspective, and it's just my perspective, I'm not speaking on behalf of the judicial system, but on my behalf, or from my perspective, the best way to keep people from languishing in jail and then in the criminal justice system is to prevent them from coming there in the first place. And at this point, the reality, as law enforcement I expect will tell you, is that law enforcement has three options. They can either leave them on the street, which isn't practical. They can bring them to the emergency room, which is often not very effective, very expensive, and not practical. Or what the default is, as law enforcement will tell you, is bring them to jail. And at that point, nothing good happens. So what the bill that you've heard about is designed to do is to provide a fourth option, which I wholly support, and that is to give law enforcement another option where mental health professionals can move people into the areas with the services that they need to treat their issues on a long-term basis. So thank you for coming, and thank you for your work, Senator Goodwin.
Thanks for yours. I think we'll have Jim Franklin from the Sheriff's Association speak first, and then we'll have an actual sheriff, and then a police chief from my district, Chief Jacobson from New Brighton.
Thanks, Senator. Jim Franklin, Executive Director for the Sheriff's Association. And I just want to speak in very quickly in support of the bill, number one. Number two, Sheriff Hodap from Beltrami County called and could not be here today and asked me to make a couple of comments. What impressed me when I went up to Beltrami to participate in that meeting was all of the people and the teamwork that they have in place. It's a wonderful structure. They need support. They need additional resources. Our system in the state is built on silos. It's not built in a comprehensive approach where we can treat someone. For us in law enforcement services, oftentimes it's a medical issue, as the judge has already alluded to. We need to get that taken care of. Oftentimes it's drugs, it's alcohol that needs to be treated first before you can get to the mental health types of issues. Bringing this together gives us an alternative and also brings the collaboration of the community together. We think this is a wonderful approach. There's a biblical saying that says, "Am I my brother's keeper?" It certainly is. We all have a part in this participation, and we're hopeful that this will give us an opportunity to get people a resource before they get to the crisis stage of where we have to jail them. Thank you.
Chief Jacobson.
Thank you, Senator Goodwin. I'm Bob Jacobson. I'm the Director of Public Safety for the City of New Brighton. I want to thank Senator Goodwin, who is from my district, and Representative Hancock and Representative Zerwas for sponsoring some legislation that could help stop that revolving door of law enforcement dealing with those who have mental health issues in our community. We know that, speaking from the law enforcement and the police perspective, that law enforcement agencies, we need to continue to enhance our approach to mental health related calls in our community. Like it or not, we are on the front lines. We are that first call most often for service for those that are suffering from mental health issues. And this has become an increasing challenge for us over the last several years. We also recognize that we in law enforcement need to continue to train to be a better part of the system. to assist those with mental health issues. Just as we train for first aid, for use of force, for investigating criminal activity, we also need to train to deal with those who have mental health issues in our communities. It's our job, and we are committed to doing it in the safest manner, both for law enforcement and for those in the community that we serve. We just did a survey with the Minnesota Chiefs of Police Association, checking with our members to see how this impacts what we do on a daily basis. 95% of our law enforcement leaders who responded reported an increase in mental health related calls over the last 5 years. So there's been a significant increase. And nearly a quarter of those who responded to that survey said that they have experienced a 50% increase in dealing with those with mental health issues. So anything that we can do to reduce that would be appreciated. We know, again, in law enforcement, we need to increase our awareness of mental health issues. We do need to know that we need to treat it less as a criminal issue and more of what it is, truly a mental health issue. And we know that jail and detox centers are not necessarily the best place and the best solution, and treatment is more often than not the best long-term solution for those who are suffering from mental illness. We are committed to becoming better trained. We're committed to becoming a better part of the mental health system because, again, we are generally that first call for help, and we know that prevention is the key. Even in New Brighton, we've had many issues with mental health. In 2013, our officers responded to a young man who had called in, reported that he was the victim of a home invasion robbery, and he reported that there were several people that were breaking into his home with weapons. Our officers responded. They located a gentleman who was outside of the home who had called to report people breaking into his home. That gentleman was suffering from mental illness and mental health issues. The home invasion robbery was not taking place, yet this gentleman was outside of his home armed with a long rifle ready to take on law enforcement and anyone else that happened to be coming into the area. Our police officers responded. They responded in a professional manner. They realized very quickly that this gentleman was suffering from a mental health issue, not from a criminal issue. That gentleman was taken into custody and taken to an emergency room, which was our only option at that time for getting him some of that treatment and that help that he needed. We tried to keep him out of the criminal justice system. We did not make an arrest, but again, we know that there are more options that are needed for people that can be potentially violent. We need better training for our officers to show and use restraint when needed, and we need other options for those that are suffering in our community with mental health issues. So again, we are hoping that this legislation that we support goes forth both through the House and the Senate. We know that there's a need, again, for other options. There's a need for continuing training for law enforcement in the form of crisis intervention training, and we hope that somewhere along the line some more funding can be made available for that as well. We know that the diversion programs that might be available through this bill would also be, again, extremely helpful. So again, we support Senator Goodwin, Representative Hancock, and Representative Zerwas. We appreciate them coming forward with this legislation, and we're fully in support. And we know that this could help us better serve those community members that we truly are sworn to protect and serve. Thank you.
I just want to add to Chief Jacobson's remarks that the police officers I talked to around the state have to wait anywhere from 2 to the longest I heard was 11 hours in an emergency room with a person, oftentimes before they're even seen. In Brainerd, there was an officer that sat in a hospital for 11 hours and couldn't get treatment for the person he brought in. He finally had to charge her for trespassing so he could get a jail bed for her. So this is the kind of thing we're trying to prevent. And next would be our sheriff.
Good afternoon, everyone. I'm Major Darrell Huggett on behalf of Sheriff Stanek with the Hennepin County Sheriff's Office. We're here today to support Senate File 141 and the work behind Senator Goodwin. The Hennepin County Sheriff's Office, as you probably heard once or twice, operates the largest jail in Minnesota. We book approximately 36,000 people a year with an average population of 700. That's a lot of folks. Conservatively, we estimate 1/3 of our jail population is suffering from untreated mental health issues. And unfortunately, this trend is nationwide. Our jails are becoming a holding place for those who suffer from mental illness. Over the past several years, we've focused on how we can address the issues when they arise for those suffering from mental illness that we come in contact with the criminal justice system. We have made some progress. Over the past couple of years, we've worked with our legislature to pass new laws which seek to speed up the judicial process when we have inmates in our jail suffering from mental illness. Senate File 141 takes the important next step. This bill will support important work that we in Hennepin County are trying to do. That's to establish a better way to deal with low-level offenders who are in need of mental health help out in the community. We'd like to thank Senator Goodwin for bringing this forward. Thank you.
We also have Kevin Kyer from the Board of Public Defense, or I'm sorry, Mr. Ward from the...
That's fine. I'm Bill Ward. I'm the Chief Public Defender. I'm the State Public Defender for Minnesota. I'm fully supportive of this bill, and as many of you can understand, as the Board of Public Defense, we represent the vast majority of the folks who are being charged and arrested with these low-level offenses. We've known for decades that the process of not having institutions available for folks who are suffering from mental illness and being charged with crimes has not done our communities any good, and certainly not my clients any good at all. And so in speaking with the various sheriff's departments, police officers, those in the mental health arena, we've known for a long time that this is something that needed to happen. We had to effect change so we didn't have these clients in and out of the system over and over again. When they get into the criminal justice system, our job as lawyers is to do the best we can in either litigation or sentencing. Mental illness is a part of that, but we're not focusing on that. We have to focus on the criminal justice issues that they're faced with. So in working with Senator Goodwin and the Offenders with Mental Health Illness Committee, and coming up with this idea of a hub where people can be transferred or diverted versus being charged with crimes, will not only just help the clients and their families in addressing these very serious issues, it will certainly be a better way of going forward on these low-level offenses. So I'm fully supportive of the bill.
And I don't know, is there anybody else that would like to speak? Thank you. I just want to wrap up then. I think, you know, there's a number of states that are facing this issue right now, in fact, most, because the federal government withdrew funds after they got everybody to deinstitutionalize, and they were going to put all this money out there for community resources, and they didn't. And then, of course, the states got into a lot of financial problems, so they were actually cutting funds for mental illness, thinking that was not as important an issue. So this is the result. This is the result, is 30 to 70% of people in jails have a mental illness. And we are hoping that we can take a lot of pressure off the system. We're hoping that we can reduce costs to the system, maybe not very initially, but eventually we can reduce costs. This crisis bed plan goes along very well with what the governor is proposing, because he's proposing 160 the governor and the commissioner of DHS are proposing 160 residential treatment beds. So that would be a place that if they needed more than just the 3-day crisis care, they could transfer. So with that, we will all stand for questions if you have any questions.
Would interaction with law enforcement be necessary to be placed in one of these?
Thank you for asking that question. According to the bill right now, it will, but my amendment tomorrow is going to open it up to other people in crisis as well, so that they can avoid. One of the concerns of the mental health advocates is that people would just have to call a police officer in order to get a bed, or in order to get, outpatient or whatever from the center. We don't want that to be the case, but we do want to make sure that law enforcement has open beds available for diversion, because that is, right now one of the most pressing problems we have.
So will these be across the state? I mean, how strategically placed do you anticipate?
Yeah, at least half of them have to be in rural Minnesota. At least half of these crisis centers. Now, there's $8 million, and you can get a grant for up to $2 million. Some places already have partially some kind of a center developed, so they might not need the whole $2 million. They might be able to to do it with less, so we could have more than 4 or 5. What we really want is a real trial on this with an evaluation, and I can't personally see how it's not going to work. And I went down to Florida and looked at their facilities down there. They have a huge facility in Orlando. They've saved $50 million on emergency costs alone and a lot of money on jail and so forth, but they have this complete array, even job skills training, and the case managers follow them right back into the community. That's the kind of thing on a smaller scale that we're hoping to do.
So can somebody from law enforcement answer this then? Are you open to the idea of maybe driving 3 hours one way to get somebody into one of these hubs? If the idea is to try to save time from an emergency standpoint, is this a viable option?
Speaking from the state sheriff's point of view, we cover 87 counties, every inch of the ground in the state. We are currently transporting people 150, 200 miles to Fargo, North Dakota, Sioux Falls, South Dakota, currently. So again, this is a starting point. This is not an end-all. If we take an overlay and look at all of our regional kinds of centers in the cities, perhaps we should be looking at an expanded model in future years to better serve our populations. Secondly, where are our populations going to go in the future? I think we have to look at kind of the demographics of our community. But this is a starting point. Are we willing to drive a few hours? Absolutely, because we're currently either driving it now or we're sitting and waiting hours for services.
You know, as was mentioned, a lot of mentally ill people are taken to jail because that's the only place, you know, that they can be kept safe. What will the layout be like for these? Will these be high-secure facilities?
The Florida model is not a high secure facility whatsoever. The police bring them in. Takes the police 3 to 11 minutes to process them. And when I was there were 5 police cars that drove up at different times. In just the hour or so I was outside, they bring them in sometimes in handcuffs, but they drop them off. They answer a few questions and they're on their way. There is one quiet room in case somebody is extremely agitated, and they keep them in that quiet room for a few hours, and that is locked. But if they're not in that kind of a state of mind, then they go just to, and they are admitted for crisis care, overnight care, then they are admitted to a room, and the rooms are not locked. And they said that after the 3 days, people have the right, of course, to leave, because it's a 3-day hold like it would be if they were brought to jail. And they have the right to leave, and but some of them stay longer, not all of them, but then they can just walk out after. And it's a choice for sometimes, too. The police can ask them, how do you get them to go there? Well, the police can ask them, do you want to go to jail or do you want to go to the crisis bed? You know, if the police officer decides that he or she thinks this person needs care versus incarceration.
So this is not for the most out-of-control mentally ill people at this point. They would still go to jail. Is that correct? Or are these like mid-level?
I think you're going to see a continuum, and you're going to see some discretion. If, you know, there will be a continuum within these facilities, there'll be a continuum of care, so that if someone is combative and is in a severe crisis, acute crisis point, they're going to have the ability to treat that patient. If the person is less combative and less irritable, there'll be a different setting within the facility for that. If the police officer determines that the person is a better fit in jail because they've broken the law and they're combative and they deserve to go to jail, nothing in this bill will compel law enforcement to bring people here. It's another option. It's another tool on the tool belt. And so I think what we're hearing a lot from law enforcement leaders across the state is right now their hands are tied. And it's either bring them to an emergency room, or many times after 4, 5, 6, 10 hours, they'll be released back to the officer anyway, in which they'll still end up going to jail, or there's an opportunity to divert to an immediate mental health specialist. But I think it's one option. Like I said at the beginning of the press conference, this isn't by any means a silver bullet. But I think it provides one more option in dealing with people that are in an acute state of mental illness and need some help or services.
Again, I think from the law enforcement perspective too, we understand that prevention is the key, and taking someone to jail oftentimes is not the best alternative, no matter what the situation is, unless they're a danger to the community or they've committed a violation so significant that they must go to jail. But one of the things, if it's a low-level offense, they may be booked into jail and they could be out within 2 to 3 to 4 hours. Whereas if you go into a system of treatment, that they could be there for 3 hours and get that long-term care option, perhaps, so that we don't have to respond to that person with mental illness or mental health issues down the line. So again, this could be a time saver for law enforcement. Ultimately, this could be better for those that are suffering from mental health issues. And again, our jails, as our sheriff partners will tell you, they have enough people coming and going as it is, and we don't want to add to that issue. So again, prevention is a key. If you look at community policing models, we look at all options that are available. As Representative Zerwas has told you, it's just another option, another tool on the tool belt that gives us some alternatives in dealing with those in our community and try to determine what we hope is the best course of action for them to prevent that future behavior.
I want to add one thing about why we decided that it would be counties to get these grants and to coordinate the whole thing. It's because another thing I heard around the state is that the private providers and the nonprofit providers don't have to take people that are aggressive or beginning to act aggressive. And if they do take them, they do take people that become aggressive, then they end up calling the police to take them anyway. So, we have to do it in a way that the county or the state government can't turn people down. They have to be able to accept them. They have to be prepared to care for them. Oh, but we do have them working with everybody involved, and so we have in the bill that they will work with the nonprofits and the for-profits and the hospitals and everybody else that is involved, and perhaps even they can share costs. I know in Florida, the hospital not the hospital association, but the Orlando hospitals, Orange County hospitals, put in $250,000 for startup funds for these centers. So we'll have to talk to the hospitals about that. I don't know how that would go, but and I really appreciate again, I appreciate your time and hope that this is so important. I just hate to see it go another year or two, because the numbers just keep going up in the jails, and we're trying to prevent that. It will definitely not prevent jails from having people with mental illness still in the jail, but another part of the bill is that these centers where they exist will have to go in when the jail wants them to do assessments to help people. If the jails don't already have people that can do that, then the center will also be responsible for working with the jails to help them with people that are remaining in there with a mental illness. Thank you very much.